Hello, good morning everybody, and welcome to this session all around the menopause, looking at some common myths and looking at the actual facts around them. My name is Nicola. I'm one of the health and wellness experts from within the ToHealth team, and I'm going to lead us through this 30-minute live broadcast today. What we are going to cover during this broadcast, we're going to look at what the menopause actually is quite briefly, just so we've all got some level of understanding before we dig into 5 really common myths around the menopause. We're going to look into why those myths exist. We're going to look at some of the evidence behind them, look at why we can start to debunk some of these myths and get some of the facts out there around menopause. At the very end, we've got a little summary just to bring everything together, and I've got a big page of resources for you as well if you're looking for any further information. So let's start by what is the menopause. It's something that we're starting to discuss more and more. Tomorrow is World Menopause Day on the 18th of October, so it's a really prominent topic at the minute, and it's great to see more and more people joining in this conversation. And hopefully after today's session, you will be able to answer what is the menopause with a little bit more confidence. Menopause simply means a permanent stop to the menstrual cycle. It isn't a quick process for most, often takes a good couple of years. During this time, the function of the ovaries begins to fail, which causes them to produce less and less of a hormone called estrogen. As these estrogen receptors are found all over the body, as these levels begin to change, it causes some significant and quite widespread symptoms throughout the body. This process of menopause continues in individuals. The menstrual cycles become longer or shorter, bleeding can become lighter or heavier, or in most cases, both of these become completely unpredictable. Once somebody has not had a period for 12 months, it is said they have reached menopause. Until that point, they are classed as perimenopausal, which is the term that we use for that transition period from premenopause to menopause. There are many different types of menopause. These typically fall into 2 categories, natural or induced. Natural menopauses are typically linked with age, and induced menopauses can happen at any age, at any time, depend on personal circumstance and medical history. But we're going to cover these 2 differences, different types of menopause, a little bit later in the session. So as we said, it's a really common thing. Anybody born female is going to go through menopause. So hopefully by us all educating ourselves about what menopause is, we can start to appreciate and understand the changes that are happening in the body, because as we said, they are quite widespread, they are quite significant as well. So let's start with our first myth. Now this myth is something that was a very kind of long held belief around menopause, and this is just for older women. Now, hopefully we've started to bust this myth a little bit in that first slide we've just looked at. For a long time, as we said, it has been associated with an older or a middle-aged woman. However, now we know menopause will happen at some point for all individuals that are born with ovaries. Whether that's a natural or induced menopause will depend on individuals and their medical histories. On average, the average age for menopause in the UK is around 52 years of age, but it can happen at any point. And the number of people going through what we call a premature menopause, which is under the age of 45, is on the increase within the UK. Aging is just one factor that can induce or bring out a menopause. There are lots of other things that could happen or could cause menopause or menopause-like symptoms. This could be premature ovarian failure as a consequence of some eating disorders, because of surgery, it could be because of conditions like cancer or PCOS, so polycystic ovary syndrome. Some drug therapies, some treatments for other health conditions or hormonal imbalances also bring about a menopause as well. As we've said, and it's really important that we focus this here, and when you think about menopause, think about it being anybody born female will go through a menopause. Anyone born female who is going through the process of gender reassignment, so transitioning from female to male, may also go through menopause as a part of that transition as well, but that's not a guarantee. So when we think about menopause, it's really important that we don't only associate it with older women, women in their 50s or 40s, because it's something that can happen at any point to lots of different people in lots of different stages in their life. By supporting all individuals who are going through menopause, therefore we are making sure that anybody going through that transition doesn't miss out on the support that they need, doesn't feel isolated, doesn't feel excluded from the conversation and the support, and we are encouraging anybody and everybody to get the help that they need. So the myth that we have is that it's just for older women and that it's just for women of a certain age, and what we actually now know is that anyone born female will go through menopause at some point in their lifetime. What type of menopause they have will vary quite a lot. So the second myth, I think a really common myth around menopause, is that the symptoms are only physical. While the most common symptoms, both in terms of incidence, so kind of rate, and awareness around them, do tend to be the physical symptoms, in particular what we call the vasomotor symptoms, which are those associated with hot flushes and night sweats. And for a very long time, there was very little information around any of the other impacts that menopause have on us, psychologically, emotionally, socially as well. With lots and lots of women reported that there were changes to their mental health during menopause, but they weren't realising that menopause was actually a contributing factor. Some of the main psychological symptoms include mood swings, feeling more anxious, feeling more low, or increasing feelings of depression. It can be changes in confidence or self-esteem. It can be increased feelings of irritability. I had a lovely woman describe it to me once as the menopausal rage, which I think anybody been through menopause can quite associate to. Now, we don't fully understand why, like most things in menopause, we don't fully understand why these symptoms occur. What we do know is that as estrogen levels begin to decline and fluctuate in the body also produces less of another hormone that is called progesterone. Now, both estrogen and progesterone together influence the production of the neurotransmitter called serotonin. We may have heard of serotonin. It's really important in helping regulate our mood. So as hormone levels begin to change, hormone levels of serotonin begin to change, which often makes our emotions less predictable, more extreme, and can also bring about an exacerbation of all of those other mental health conditions or concerns that we may have previously had. These symptoms are really common. They shouldn't be discounted, they shouldn't be ignored, and there is help and support out there if you need it during this process. Sometimes these symptoms don't meet the clinical threshold for treatment, but that doesn't mean there aren't other self-help remedies, other support that we can get to help us through some of these symptoms during this transition. It's hopefully pleasant to us all to hear that these do tend to be temporary while those hormone levels are fluctuating. When we do reach menopause and those hormone levels do begin to settle down, we do typically tend to see the psychological and the physiological symptoms settle down as well. But during this period, it can be really difficult. So don't ignore the psychological symptoms. Don't think that they aren't recognise, they are part of your menopause and that it isn't something that's affecting them, because it definitely, most definitely can and will impact psychological health during that time of transition. So our second myth, symptoms are only physical. We now know we've busted that. We can all be confident in saying that the symptoms of menopause can greatly vary. They can be physical or psychological. No symptoms should be ignored. If you are struggling with your mental well-being, there are support services available, and you are well within your rights concerns to go, yeah, I do need a bit of help here, my psychological health is being impacted, I think menopause is the cause of it, but we can still help. It doesn't mean just because we'll go, oh, it's caused by menopause, it means we're going to ignore it and that you can't get the support that you need. So 2 really important myths busted so far. Menopause happens to anybody born with ovaries. It happens at any age, at any time. It can be natural or induced. Symptoms can be physical or psychological. So let's move on to our 3rd myth, and this is quite a hot topic around menopause, and it's something that a lot of people tend to have a lot of questions about, and this is HRT. So hormone replacement therapy, for anyone who doesn't know, is a way of replacing the estrogen that's lost. It has had some proven benefits for some, but not all menopause symptoms. There are some side effects that come with taking HRT, and they do typically resolve themselves within the first few months. But with HRT, it's a bit of trial and error normally to find out the right hormonal combination, the right dose and the right delivery method that's going to work for you. It can be very difficult to know what to say about HRT, especially when we start reading about it quite extensively, because there is so much conflicting statements, there's so much conflicting research, and to be honest, quite a lot of misinformation about HRT out there as well. However, only you can decide whether HRT is the right choice for you and for your symptoms. Before we do, we want to make ourselves fully aware of the research and of what's out there when it comes to menopause HRT. So concerns were raised for a really long time around HRT, with an increased risk of breast cancer and ovarian cancer, and sometimes even heart disease. And for this research, there's been a lot of debate about HRT's long-term safety, and it all stems back from this research that happened years ago, back in 2002, that was misreported by the press. Early results that weren't fully understood were released, and it actually led to a worldwide reduction in HRT use, which we're still seeing today. The study found that there was an increased risk of breast cancer when women took a combination pill of both estrogen and progesterone, as well as an increased risk of heart disease and blood clots as well. As I said, these results were released really early by the press, and they hadn't been properly analysed. And the preliminary conclusions were applied to all age groups, including healthy women. When they'd done the full analysis of the study, it showed that women taking HRT were actually a lot healthier and had less diseases than those that were not taking HRT. Women who take estrogen-only HRT actually have a lower risk of breast cancer than those not taking HRT. And many people are still within the right minds, very concerned, very fearful around when it comes to HRT. And that has caused actually some doctors to discourage the use of it, because of all based about this kind of study that happened back in 2001. So what we know is that women who take estrogen and progesterone may have a small but increased risk of breast cancer. However, this risk is, as I said, a really small risk. Is actually the same magnitude to the increased risk of breast cancer from those who drink a glass or 2 of wine each night. So it's a really, really small risk. Put it into perspective for us, those of us who are classified are obese or have a 10 times more likely risk of developing breast cancer compared to those on HRT. So there is a risk. It's a very, very small risk, but therefore you have to decide whether it's worth it for you. And then you can have the conversations with your GP and really get to a point where you feel comfortable with your decision around HRT. What I do want to highlight for us all is that HRT is not magic. It isn't going to work for everybody. It isn't going to magic away all your symptoms. And there are lots of instances where people cannot take HRT because of other health conditions, maybe because of their risk of breast cancer, if they have low blood pressure, for example. They're quite cautious around HRT usage, but have the conversation with your GP, with your doctors. If they can't give you a legitimate reason why you can't be on HRT and you really want it, then continue to ask the questions and push for it as often until you get kind of a satisfactory answer. It's really, really common in the UK for HRT. Prescriptions were around over 500,000 prescriptions in the UK back in December 2021. There is a government proposal in England to make HRT prescriptions available on an annual basis. So we just pay for one fee instead of monthly. That was delayed until April 2023 in Wales and Scotland. You get your prescriptions for anyway, so it's not a concern for you. So when it comes to HRT, there is a slight cancer risk. I don't want to minimise that completely, but it is very low, it's very small. HRT can be really useful to help treat some of those symptoms of menopause. So our method that it's dangerous or it's definitely going to give us cancer, we now know that HRT can be a safe and effective way to treat some, but remember, not all symptoms of menopause. It doesn't work for everybody and isn't suitable for all. Do your research, talk to doctors if you think HRT is going to be beneficial for you. And remember, we might need a bit of perseverance in those first initial months just to help us through those side effects until we get that right combination and, importantly, delivery method for you. So let's move on to our fourth myth. And this is on a similar vein to talking about HRT. This is talking about changing our lifestyle. We've spoken quite a lot, and it's quite a lot of information out there looking at quite how much menopause can affect people. So lots of people ask, will changing my lifestyle make any difference at all? And in short, the answer is yes. Lifestyle changes aren't going to magic away our symptoms. They aren't going to get rid of them completely. What they can do is make our symptoms more manageable. It's often a time in life where we can reassess how we treat ourselves. You know, we can make our health and ourself a priority and make some small changes that can help just take the edge off some of those symptoms. Some of those small changes could be things like our diet. Now, when it comes to diet, please don't do anything extreme or rash or cut out any whole food groups or anything like that. Food is our fuel. It keeps our body working as well as it can. So eat regular nutritious meals, drink plenty of water. Some small changes to our diet, looking at things like including more calcium or vitamin D can help with our bone health, including lots of healthy fats can help with our heart health, and making sure that we're eating enough food for us, so we're not over consuming foods will all help with our diet, just to help look after our heart and our bones, make sure we're getting enough fuel, but we're not increasing our risk of weight gain, which is very typical around menopause. Now, when it comes for sleep, sleep is often very much affected by menopause. I often joke that sleep and menopause are not friends. So practice good sleep hygiene, try to keep a routine, avoid screens for up to an hour before we go to bed, reduce caffeine, alcohol and nicotine, because they're all going to have a negative impact on not only our sleep, but some of those menopausal symptoms as well. And if you really are struggling, track your sleep pattern and your challenges you face for a couple of weeks and go and speak to your GP if you don't see any regular improvements. And physical activity. Regular physical activity not only helps us reduce stress, helps improve our mood and our concentration, it can help us clear our thoughts and deal with our emotions more calmly. There has been some evidence to show that regular exercise can help reduce the incidence of hot flushes as well, because of that reduced stress as well. So try to be as active as possible. Take it as a bit of time for yourself, away from everybody else, away from your to-do list, to do something just for you, something that you enjoy, that you look forward to. And move as often as we can throughout our daily life, and that will help burn off some of those stress hormones and release as much of those as that serotonin as we can do. Now, alcohol. The combination of excessive alcohol and the hormonal instability that we experience during menopause can be a very risky one. Alcohol raises our internal body temperature, so can worsen hot flushes and night sweats. As we mentioned earlier, it linked with an increased risk of breast cancer, and it also is a diuretic, so makes us go to the toilet more. So if we're struggling with sleep anyway, alcohol and sleep aren't friends. Menopause just makes that whole relationship a lot worse. So we're not saying cut out alcohol completely. enjoy it sensibly, and it might be time to consider whether it's worth it for you at the moment during that kind of menopause transition. Now, when it comes to menopause, it does bring about a lot of stress. What symptoms am I experiencing? Why is this happening? How long is it going to last for? Why, when is this going to end? So taking some time for ourselves, doing something that we said helps us release that stress, whether that is a hobby, whether that's a craft, a exercise, absolutely anything that we do that just gives us that time for ourselves to practice those simple forms of self-care is so important. It is vital to help us manage our stress, to be kind to ourselves and to put our well-being first. And all of these things combined will hopefully help take the edge off some of those symptoms. As we said, the myth we had was changing our lifestyle isn't going to have an impact at all. But what we do now know is that some small, meaningful changes to our lifestyle can make some of our symptoms a little bit more manageable. They can increase that feeling of being in control of our menopause experience, and they can give us something positive to focus on that feels like we're taking action and we're doing something for our symptoms and for ourselves. So our final myth is potentially one of the most common that I've come across when talking to hundreds of women about menopause, and that is the saying that I have to carry on regardless of my symptoms. This is a myth that so many of us report. Now, this can come about for lots of different reasons. It could be that people don't feel comfortable, nor do they want to talk about what they're experiencing. It could be that they do not know where to go for that support, or that they feel like asking for help is admitting defeat, or might make them appear weak. Now, please, if you are experiencing menopause, or you're going to, or you know somebody that is, if you're having any menopause symptoms, please believe that there is so much support out there. You do not have to carry on regardless of your symptoms. It doesn't matter how intense they are, how long you've been experiencing them, whether you're at the start, the middle, or the end of your journey. If menopause is impacting your daily life and you are struggling, please speak to somebody, anybody, because it really does help. The NHS and medical services are there to support you during the menopause journey. This normally initially starts with a conversation with your GP. They can discuss lots of different options with you, whether it's a referral to a menopause clinic, to medications like HRT, or to other support you may need. Within your working life, we spend a lot of time at work, so don't think you've got to suffer on when you're at work as well. Talk to your line managers, your HR departments about what reasonable adjustments may be available to you. If your company has a menopause policy, that can help you, be used to help you. If there are any employee assistance programs that you have access to, these can be places that we go for confidential and independent support to use as often as you need to as well. A lot don't feel comfortable talking to managers at work, especially if your manager is younger or a male, but more and more, people are understanding menopause and the awareness around it. So the support is there. Have the conversation, speak to somebody you feel comfortable talking to, and hopefully that'll start to open up that support that you need. Now, the social support from our family and friends is often the most valuable support that we can have. By including those around us when we feel comfortable to do so in our menopause journey, means we get the ongoing support that we need daily from our friends and family, from those that we work with, to those people that we interact with on a regular basis. There's also a plethora of different charities and support out there that we can use, and as I said, I've got a list to show you of those later. This is one of the things that I like to talk about menopause quite a lot, because it can be a really isolating time for us. It can make people feel like their body is changing quite a lot. They don't really have any control over it, and there's nothing that we can do to help. Now we know that body is changing quite a lot. We do now know that there is a lot of support there. While it can seem really isolating, it can seem really scary to talk to somebody about menopause, if you can find one person to talk to, that can be the starting point to make you fully appreciate what support's out there, what help that you can get, what support that there is for you. So just remember, and if you hopefully you take away a lot from the session, but if you take away nothing else, please remember that support is there. It can be scary to ask for, and it might be really kind of a big step for you to take, but once we do it, it can make this difficult time a lot less challenging. It can help us realise that we're not alone, and as I said, it can help take the edge off some of those symptoms as well. So those were our 5 myths. Hopefully now we're feeling a lot more confident around menopause. Some of these myths, we now know the facts behind them. Menopause happens to anybody born with ovaries, so not just older women. We know that symptoms can be physical as well as psychological. We know that HRT can be safe. It is very safe. It's very effective for some, but not all menopause symptoms. We know that lifestyle changes can have a really big impact. They can make a lot of our symptoms more manageable, but they aren't going to magic them away. And we know that there is lots of support out there from lots of different areas of our life, that we're not alone in this, and that with the right support, with the right lifestyle changes, we can get through the menopause transition. We can get to the other end of this journey. So just to bring everything all together for us, just to summarise the session today, as somebody moves through this, what is a very, very inevitable stage of our life, remember, treat the body with a bit of tender, loving care. A symptom-free menopause is ideal, but for most it doesn't happen. In fact, only 6% of people don't have any symptoms of the menopause. The important message is to not struggle. Be reassured that good advice and support is available. You are in charge of your health. You are in charge of your body. So do what you need to do to make yourself feel better during this journey. And talk to those people around you and get the help that you need. Some resources for us, some further information if you do need them on screen for us now. A couple of really, really useful ones. The DAISY network is a really great one for anybody who's experiencing a premature menopause. The Hysterectomy Association, great for those who have gone through a hysterectomy. The Queer Menopause Collective, a really, really great resource offering greater education and more inclusivity around menopause, specifically talking for and about people who are LGBTQIA+, and Women's Health Concern is a really great independent resource as well. That is the end of the session today. 30 minutes flies by when we're talking about menopause, but hopefully we've all learned a lot. We feel a little bit more confident, a little bit more comfortable talking about menopause. And thank you very much for attending, for giving me your time and for listening. I've popped some of our information on screen for us now as well. If you want any more information on menopause or anything else from ToHealth, please do feel free to get in touch. Thank you for coming, and I hope you have a good rest of your day.